everybody. It's Dr. Diane Mueller. I am so excited about our next guest, Dr. Nafysa Parpia. Welcome, Dr. Nafysa. I'm so happy to have you.
Thank you, Diane. I'm so happy to be here.
I'm really looking forward to this talk. So let's kick it off right away. Tell us a little bit about yourself, how you got into this world. You treat a lot of chronic infections, tick-borne illnesses, work with a lot of toxins, sinuses. So how'd you get into this very complicated and interesting world?
Yeah, so for the past decade or more than a decade now, I've been treating people who have complex chronic illness that includes tick-borne diseases, Lyme, Bartonella, Babesia, all those co-infections. They have high viral loads, they have parasites, many chronic infections, and a high environmental toxin load. Now, how did I get into this? When I graduated from Bastyr a long time ago, I knew that I wanted to do more than primary care. That's what they had trained me to do, like all good naturopathic schools do. But I wanted more. And so I was lucky or blessed enough to be invited to work into Dr. Klinghart's clinic in Seattle. And so I shadowed him for a year and worked in the IV room. And I just learned so much. And from there, I went to learn from Dr. Isaac Elias, who is a very well-known integrative oncology doctor. And he invited me to come on board and lead the Lyme and chronic illness side of his clinic. When I saw what he did for people who have cancer regarding detoxification therapies, I thought, let me try this with people who have tick-borne disease, because I know it's working to change their immune system to bring about some immune regulation. When I added in those IV therapies done in a very particular way by Dr. Elias, I saw that it was easier to treat tick-borne diseases. So from there, I then went on to Gordon Medical, where I've been at since 2016, and the whole clinic focuses on complex chronic illness. So it's wonderful to be there.
Oh, such a good history and amazing teachers. What a great foundation to kick everything off with. It's so rich. I love it.
Thank you. I feel very lucky for who my mentors have been.
Yeah, absolutely. Absolutely. And I want to jump right into one of our main topics, that we talked about talking about is sinus and the sinuses and relationship to mental health and relationship to chronic illness in general. So let's start, if you would, just help us make this connection. Like, where and why are the sinus and sinus health? How is that integrated? Why is it important in relationship to mental health?
Thank you. So I'm very excited about this topic. I find that there are not too many people thinking about it, and the research is new. It's just up and coming, right? So we think about how close the proximity the sinuses are to the brain, and that gives us a big clue as to what's happening. So with chronic sinus inflammation can come brain inflammation. Now, people often think about the gut microbiome. That's commonplace now in medicine. And there's so much research about the gut-brain axis, but there's much less about the sinus-brain interface. So a lot of this comes from what I've been seeing in my patients more than the research. So there is some interesting research that came up, I think it was last year, which I'll talk about as well. But what I've noticed is that those with chronic sinusitis often have inflammation from the sinuses that can lead to symptoms of the brain fog, mental fatigue, executive functioning issues, depression, sleep problems. You treat the sinuses, and oftentimes these issues will go away.
Yeah, it's interesting, right? And I think it's so under talked about, like you said, because the membrane, as we know, between the sinuses and the brain is so thin. So before I ask you the next question, I'm going to veer off just for a second of like, what in your experience do you see from just that thin level of the membrane? Are you seeing that toxins or even infections, because of that thin layer, are actually getting into the brain more easily?
So it's what I believe. I wish there is a way to test it. There's not. But what I do test is the infections in the sinuses. A lot of times I'm finding molds or funguses in there. I'm finding bacteria. And I know that bacteria create biofilms. I know the molds create mycotoxins. I know that wherever there's infections, there's going to be inflammatory cytokines, and those can cross the blood-brain barrier. So I believe, I believe this. Why? Because once I treat it, once I get rid of the infections, once I bring inflammation down in the sinuses, I'm seeing that their brain fog or their executive function issues or their depression, that goes away. But these patients also have a variety of infections, so including tick-borne disease, mold issues, viruses, parasites, dental infections, which can also affect the brain. So they have a high environmental toxin load and structural integrity issues and emotional triggers. So they have immune dysregulation and neuroinflammation that's stuck in a loop caused by so many issues. So it's not just the sinuses, but treating the sinuses has a huge impact on their health. There's a lot of other treatment that has to be done with these patients as well. But definitely in treating their sinuses, I see changes in their cognition, even if I haven't treated anything else yet.
So let's go deeper into that. So you're saying changes in the sinuses change the cognition, they change neuroinflammation. What else from like a symptom picture are you really seeing as far as brain function and what's happening with dysfunction in the sinuses? So besides neuroinflammation and cognition, what else are you seeing in a level of brain
Yeah.
health?
So I'm seeing that it's definitely linked to mood changes, and this is well known. So people with chronic sinusitis, they're dealing not only with stuffy noses and headaches, but also with brain fog or difficulty in focusing, or they get depression, they have poor sleep. And of course, these symptoms implicate the brain's involvement in chronic sinusitis. But what's interesting is patients with chronic sinusitis, they seek out treatment for these other things, these other reasons, more than their runny or stuffed noses. And I might not even know why, or that they're linked. So they come into the office and they say, I don't feel as smart or as sharp as I used to. I'm forgetting things. I don't feel as social. My sleep isn't as good as it used to be. In fact, I'm not getting more than 3 hours of sleep a night. And then I go and I ask about their sinuses, and very often there's an issue there.
Are you testing people then just so people can start looking out? So say people have some of these things you're bringing up that are non-sinus related, but they're coming into you for some of these other symptoms. Do you ever find people that don't have sinus pain, but are still worth running the test on because of their main symptoms? Can you help us with that?
Yeah, absolutely. I do. Some of them even say, well, they're surprised when the test comes back and maybe there's mold or maybe there's a staph infection. I'm seeing a lot of Klebsiella now lately, more than ever before in the sinuses. So they're surprised. Then when I treat it, they say, oh, I didn't realize I was having issues breathing, and my executive function is better. So
yes.
yeah.
Yeah, I think so many times there's so much inflammation going on here and people develop they just cope with it, and it just becomes such their normal part of their life that sometimes they might even have symptoms there, right? In their sinuses, they might be inflamed and they don't even think of the inflammation actually occurring there.
They forget. But so there was a study done last year where those with chronic sinus infections were given MRIs to detect cerebral blood flow and neuronal activity. And the study showed that chronic sinusitis can alter brain activity. So I was so happy when I read this research, because it's actually showing what I believed to be true, but couldn't really prove. So the MRI showed that brain activity changes. It had changes associated with decreased executive function, maintaining attention and mind wandering and problem solving, issues with sleep, integration of external stimuli, and even communication and social behavior. And then so the magnitude of brain activity differences paralleled the severity of the sinus infection. Mm-hmm. So talk about correlating with the patient experience, right?
Oh, 100%. And it's so nice when we see that, because obviously you already knew that clinically, right? You're already seeing those level of results. But I think it's so helpful for people, especially in this community where we are constantly, I think, validating people like, this is not in your head. These symptoms are real, to actually then see the studies to help validate everybody's experience even more. It's how wonderful.
Right. Because how many times are our patients told, this is not in your head, you're making it up, or here, have some Prozac, you're just depressed, or, oh, it's just age.
Yeah, that one drives me the most crazy.
Yeah, exactly. Yeah.
So let's talk about mycotoxins now. So toxins from mold. So how do they actually impact the sinuses? How do they affect the sinus, and where do they fit into this whole picture we're talking about?
Yeah. So the nose is a major gateway for mold into the body, that in the gut, and mycotoxins can affect the digestive system, even the pituitary system, the hormonal system, cognition and mood. So almost all my patients suffering from mold allergies have sinus infections. So I'm measuring if they have an allergy to mold or even an allergy to mycotoxins on the labs. And I'm also testing to see what infections they have in their sinuses. Usually they've got all of this going on. So if they've got mold in their sinuses, chances are they have mycotoxins there as well. That causes inflammation. So then inflammation in the sinuses can cause other issues like hormonal disruption. Mycotoxins can cross the blood-brain barrier. Excuse me. This is my post-COVID voice. And so the olfactory nerve, it sits in our nose, it sits behind our sinuses, and it's linked directly to the brain, into the limbic system, which is made up of 3 parts. So the hypothalamus, the master regulatory center for hormones, where all the hormones are regulated. Literally, I know you know this, obviously, but just for our audience, I want them to know.
Yes, of course. Please, me too. Continue.
And then there's the amygdala that's there, the fight or flight center, which interacts with the adrenals, and the hippocampus, the memory center. So then if you have inflammation in your sinuses due to inflammatory cytokines from chronic infections in the sinuses or from toxins like mycotoxins, the toxins from mold, or people who live where we do in Colorado or California, wildfire particulate matter. That inflammation can travel up to the brain. I don't know if the particulate matter can, but I know the inflammation that it causes can. It can travel up to the brain via the olfactory nerve. And we get inflammation in the hypothalamus, where all the hormones are regulated. It can disrupt everything from menstrual cycles in women. You can get heavy menses or early menses or low testosterone in men. I see such low testosterone in my young men, actually, can be due to inflammation of the hypothalamus. So the chronic sinus inflammation plays a huge role there.
Yeah, thanks for bringing that up. I want to pinpoint at this, everything you're saying, into this thing that we see where mold is one of the great mimickers, right? So for all of our listeners, you might be thinking, if you're tracking this, like, oh my gosh, like my gut, my head, my fog, my mood, my menses. And so it becomes a little bit almost overwhelming with all the symptoms. But I really hope you're really paying attention to Nafysa here and just and listening to all the different symptoms that can really be caused by mold, by sinus issues, and by the combination of them both. And also with what you're saying, I want to ask you a couple different kind of side note things. One, with, this point that you're bringing up around these regulatory centers in the brain, right? And do you feel like because of mold's impact on the limbic system, do you feel like that is contributing to almost like this PTSD impact that we can sometimes have in mold illness people around being in moldy homes and traveling? And what if we smell mold that feels very PTSD like? Do you see that?
I do. So I think about the amygdala, right? The amygdala is inflamed. The person can get a lot of anxiety, fear, adrenal stress. And then the amygdala stimulates the hypothalamus. That stimulates the adrenals to dump adrenaline and cortisol. The person goes into fight or flight. We see it all the time. In fact, I think that a lot of the times when people have emotional issues or mental issues, I really correlate it with a lot of infections. And a lot of the times I think people come into the world, we all come into the world with our human condition. We all have 1 or 10 of those, right? But I find that mold illness and also other infections and toxins, the inflammation created by those things, toxins, infections, they cause neuroinflammation, and that can cause inflammation in the brain. So it's this picture of mold and other infections and toxins, which I find are really affecting people's brain and amplifying whatever maybe, I'm going to say, human condition we're wired with, whether we're wired with anxiety or maybe depression, or maybe some people are wired with a little bit more anger. These things, I think, get amplified by the infections.
Yeah, so it's that maybe epigenetic expression or just the
Right.
predisposition or any of those things. Absolutely. Tell
Mhm.
us a little bit about, because I know this is going to come up with the everybody that's listening to this. What tests are you doing to test the sinuses? Are you doing Marcons? Are you doing other types of tests? What are you doing there?
Yeah, I'm doing the test by Microbiology DX. So it's looking for Marcons, which is a kind of staph infection, which we find often in people who have mold illness or tick-borne disease like Lyme. And it's a staph that's very hard to treat, which is in the sinuses, but we do treat it. Now I'd say, some doctors say there's no need to treat it. Some say you treat it, you see a difference. Usually I see a difference if I treat it, but I'm looking for Marcons, other bacteria, funguses, biofilm. So that's just a sinus swab test. I'm doing that. And I'm also looking for mold IgG allergens to see if the person is having an allergic reaction to mold. And I'm often using the MyMyco test to see if they're having an allergic reaction to mycotoxins, or I'm using the Great Plains lab test to look at their mycotoxin load. I'm looking at inflammatory cytokine tests, all kinds of tests to weave it all together.
And then can you explain to us the difference between the mycotoxin load test and the allergy test to mold? Because I think that confuses people a little bit.
Yeah, I think people often even think it's the same test, but it's not.
Yes.
So, so people can have, I'm going to backtrack a bit. Mycotoxins are the toxins that molds release from the body. They're the way to subdue our immune response. Most bugs create toxins for that reason. So mycotoxins are the ones created by mold. Now, people can be allergic to mold, the bug, the spores. People can be allergic to the toxins that the mold create. Or they could have a high load of those toxins, but we don't necessarily know how that load is affecting the immune system. I know I can measure to see if they're allergic. That's with the MyMyco test. But I'm also interested in seeing what the load is, because there could be other things that the mycotoxins are causing, like immune dysregulation. There's some research actually that talks about that. So that's why I like to look at what does the body burden appear to be. We can never be sure, but we can get an idea of what the mycotoxins load are or the allergic response.
Yeah. And I hope thank you for explaining that. I hope everybody is, this is kind of complicated medically, but basically what our conversation here, just to make sure, I'm just going to say it a slightly different way, just to make sure everybody's with us. But essentially to summarize what you're saying, is basically that there's different ways we can respond to mold. One is due to this toxic buildup, this load. This other is due to this allergic response, right? Is there anything else you want to add to kind of that summary of just distilling it down for our audience around like the load and the difference between the body reacting to a toxic load buildup versus this actual allergy situation? Anything else you would add to that summary to make it super clear for everybody?
Yeah, I love the way you've said that, because it's perfect. It's that, do you have an allergic response to the mycotoxins, or is it more of a toxin reaction that you're having? And so I like to look at all kinds of toxins, actually, as do you, I'm sure. So not only the mycotoxins, but I like to look at glyphosate and other environmental toxins, metals, solvents, pesticides, so I can assess what somebody's body burden is with respect to toxins. So maybe someone has not very many mycotoxins, but they have a load of other toxins, but they have an allergy to mycotoxins. So we have to put all of this together. Each person is a puzzle or a unique story.
Yeah, I like that frame. Unique story is really nice.
Yeah.
How about COVID? So you just mentioned you were getting over COVID. What are you seeing as far as, especially within the concept of sinuses and this conversation we're having? What are you seeing as far as long-term COVID and after we're related to sinus congestion? Are you seeing a link there?
Definitely. So we're actually seeing a lot of long COVID patients. Our clinic is part of Dr. Bruce Patterson's long haul group. So we're seeing a lot. So we're seeing patients who have long COVID that were already our patients, but more than the people who are already our patients, we're seeing new patients who were never sick before, which I think is interesting. I think that a lot of the patients that were already our patients don't have long COVID because we were already treating. Concurrent infections, if you will, that show up often in long COVID and even in the sinuses. But those with chronic sinusitis who have become new patients with long COVID, I'm often seeing symptoms like typical ones like nasal blockage or facial pressure, eye pressure, a runny nose, postnasal drip. I'm seeing persistent sinus headaches between the eyes and into the forehead, and migraines. And then they can get non-specific concussive symptoms like fatigue, mental fatigue, eye fatigue, non-specific dizziness. So it's from inflammation in the brain. The inflammatory cytokines get in from COVID easy through the sinuses and the gut, and they can trigger the glial cells in the blood-brain barrier to create the same chemicals that cause brain inflammation, or the inflammation from the sinuses enter the brain through the olfactory nerve. So those are the symptoms I'm seeing.
Yeah. It sounds like similar with a twist in many ways, right?
Right.
And how is that impacting then if you're suspecting like a long haul COVID situation on top of mycotoxins, glyphosates, total body burden, all these other things, right? If you're expecting this long haul COVID, is that changing treatment? How is that influencing like your clinical process?
Yeah, that's a great question. So for the past 11 years or so, I've been seeing people who suffer from chronic Lyme disease or post-Lyme disease. And there's this intersection, I'm sure you're seeing it too, between long COVID and post-Lyme. We're seeing this similarity in symptoms. And so what makes a patient susceptible to chronic Lyme disease, I've seen, is very similar to what makes a patient susceptible to long COVID. In general, they've got many concurrent infections that were not diagnosed prior. So the inflammatory cytokines caused infections that were previously suppressed or dormant to now thrive, just like in Lyme. So with long COVID, it can include tick-borne disease or mold or parasites or other viruses, Epstein-Barr viruses or Mycoplasma pneumoniae. For example, I'm seeing these infections resurface. Now we're talking specifically about the sinuses, but it's true that we have to take everything into account in the patients with long COVID. Yeah.
And then when we're talking about treating the sinuses, so whether it's inflammation from any of these various types of situations, whether it's infections, like what I've seen in my clinical practice is the treating of some of the sinus infections. Sometimes it's the most tricky thing I feel like to treat. So I feel like this would be a really good question to go down as far as like, what are your favorite treatment strategies? How do you deal with actually, whether it's Marcons, whether it's fungus, whether it's just generalized inflammation from the allergic response to mold? How are you dealing with treating the sinuses?
Yeah, so I think about it like the gut. And so I'm just going to explain to the audience a little bit about the gut, because maybe they've encountered gut treatment more, right? So there's similarities between the sinuses and the gut. So the beneficial and pathogenic bacteria in our gut has been getting a lot of attention in the past many years, but I think the forgotten piece, or the not so research piece, is the microbiome in the sinuses. We are seeing some research now. So there are millions of different types of microbes, both beneficial and pathogenic, that normally live in our sinuses, just like the gut. So it's our sinus microbiome. The sinuses were once thought to be sterile. And then there's been more recent development of new technologies like genetic sequencing that shows there's actually a diverse community of many species of microbes that have been found in our sinuses. And like the gut, it includes bacteria, fungi, viruses. And like the gut, the beneficial, pathogenic, and benign microbes live together in complex communities surrounded by biofilm they create. So we can test for the biofilm, the sinuses, and I can't test for viruses, but definitely bacteria and funguses. So it's an area where the research is in its infancy, but it's happening. So we can get dysbiosis in the sinuses as well. Like there could be insults to the gut, like allergens, infections, or antibiotics, or in many people, gluten. There can be insults to the sinuses, air pollution, allergies, infections, COVID. So we can get dysbiosis in our sinuses just like we can in our gut. So I think about it just like the gut. And so treatment is like that as well. So then when I talk about this treatment, it's based on what I think as a naturopathic doctor. It's in no way conventional treatment, but I see it work often. So just like testing the GI microbiome, I'm testing what I can for the sinuses, all the tests that we talked about earlier. We don't have a sophisticated test for the sinus microbiome available yet, but hopefully it'll come. And so then for people who might have heard about the 4 R's of gut repair: remove, replace, re-inoculate, repair, and rebalance, something that Dr. Diana and myself learned a lot about and do a lot about. Is that those are just the tenets of naturopathic medicine in the gut, right? So first we remove. In the gut, it will be removing the pathogens and other inflammatory triggers. So same with the sinuses. I'm treating the infections. I could be nebulizing antifungals or even antibiotics if warranted. So depending on the infection and sensitivity, and then replace is next. So in the gut, we replace with anti-inflammatory foods, right? And in the sinuses, I learned this from an ENT doctor, lining the sinuses with organic coconut oil to make the area moist in preparation for the infection kill, and to help decrease inflammation is important. So he told me that if it's dry in there, then it's very hard to kill the infection. So you want to keep it moist, and the coconut oil brings inflammation down. And then the third step is to re-inoculate the microbiota with beneficial bacteria. So just like in the gut, so we want to put probiotics in there. So there's a great nasal probiotic that can be used for this. I like Nasobiotix. And the fourth step, the final step, is repair. So in the gut, we can repair the intestinal lining with many herbs. In the sinuses, I'm using nasal peptides, maybe BPC 157, or that'll bring inflammation down, or CMAX, which will help with brain inflammation. C-Lank will help with anxiety, or RG3 to decrease inflammation and heal the mitochondria in the brain. So I'll use neural peptides to decrease inflammation, anxiety. Once the infections are killed, a lot of times people might want to use the peptides first because I just want to get rid of that brain fog or that bad feeling in my mind. But usually I'm finding those peptides don't work until we deal with the infections first. And then they work amazingly.
I love everything you said. It's such a great way of framing this for people, the 4 R's of the gut, and applying that to the sinuses. So I think there's so much good there. And the nebulizing component of things, I also have seen that that's such an important way of actually disseminating the medicine there. And I love that you're finishing up with the repair with the peptides. You're using the peptides then intranasally, I imagine?
Right.
Yeah.
Right. So C-Max and C-Lank, you can spray them in, and then BPC 157, you can get spray form.
Yeah. And just so everybody knows, like, these are fairly easy things to get. Like, these compounding pharmacies are becoming more and more aware of these peptides. So they do have to be prescribed. At least they do in Colorado, where I live.
Yeah.
I imagine they do in California as well.
Yes. And there aren't too many places we can get the peptides from yet, but I get mine from a pharmacy in Washington.
Okay. Yeah. We use a few different places: Pharmakeo, Custom RX, TaylorMade. There's a few.
Right.
What is the one you use?
Prime.
Okay. That's good to have on my list as well. So want to name some of those for some of our practitioner listeners so that they know where to find some of these. So then from thinking about a treatment perspective of all of this, where do you put it? Like, somebody comes in and, you said, okay, this is their unique, I forget what you said, their unique thumbprint, or how did you describe it?
Their unique story.
Their unique story. Yeah. I love that.
Like thumbprint, that works too.
Yeah. Either way, it's a good way of framing it. So somebody comes in with their unique story, and let's say they have, you test, and they have all of these different things going on in their sinuses, and they're anxious, and they're cognitively not functioning well. And you test for multiple vector-borne, these insect-borne infections, and they have gut issues. This really, really common picture where people have so many different stories of picking from so many different similar disease processes.
Right.
Where do you put in, if somebody comes up with some of these sinus problems and this infection, this inflammation, this need to repair, inoculate, all these things, where do you put that in with the whole overarching treatment plan? Is there a general, I know it's a big, we're talking general now, but is there a general way you can help us orient to where this fits into the big picture?
Yeah, that's a great question. So before I kill any infections, I want to modulate the immune system, because I know that killing infections and even detoxification is going to cause inflammation. So I'm putting really good band-aids on the immune system first. So they start off as band-aids because I haven't treated the causes yet, right? But once I treat the cause, those band-aids then become nervous system retraining or immune system retraining. And those band-aids for me to start with are peptides. So I like to use BPC 157 to bring inflammation down in the whole system, TB4 frag to modulate the immune response. A lot of these patients have mast cell activation syndrome. So I'm using KPV and Amlexanox peptides or anything that I think is needed for that person based on the testing and based on their history that tells me they need immune system balancing first. Before the advent of peptides, I wanted to do it, but it wasn't as easy. So I'm modulating their immune system first with peptides. Then it's kind of like pickup sticks, right? Because these patients have so many different infections in different areas of their body. And I also tell them it's like layers, different layers of a cake, right? So which one is at the top? Which one is at the bottom? Which one is screaming the loudest? Sometimes if I go for the infection that's making the most noise, it can actually, the patient isn't ready for that. So we have to, it's like pulling out very gently, very delicately, which one to go for first. So it really depends on the patient. In naturopathic medicine, we're taught treat the gut first, right? Usually that's a good rule of thumb. Sometimes I am treating the sinuses first though, because I'm thinking about their brain. I'm thinking about their cognition. And I think about the gut-brain connection and the sinus-brain connection. And the sinuses are closer in proximity than the gut. Sometimes it makes more sense to come in and treat the sinuses after I've put in place the immune modulatory treatment with peptides.
Yeah, thank you for that. That makes a lot of sense. And I like the analogy of just, okay, where's that thread, right? Where is that place that we can pull and start to get these complicated things to unravel?
Right.
What else in our last minutes together, what else do you want to make sure, just like take home points? What else do you want to make sure that everybody is really clear on? Any message that you want to make sure to really just impart on us today?
Yeah, I want to make sure that people know there's hope in long COVID, because there are so many people who are suffering right now and they never were before. So you and I were seeing patients who suffered in a similar way that people did with long COVID prior to the pandemic. And it was only this small subset of the population that was like seeing the underworld of health. That's what we saw. Now all of a sudden it's coming to the surface. More people are coming in, but there are doctors and there are treatments, doctors like you and I and others who have been working with complex chronic illness for a long time. And so the stage is set to help you. There is hope. That's what I want people to know.
Thank you so much for that message. And I want also people to know a little bit about your giveaway, which is your Pre-Tox ebook. Can you tell us a little bit about that and about the concept Pre-Tox?
Yeah. So a lot of the times, I know you and I talked a little bit about this before we started our interview today. People want to do a detox right away, or they've already done a detox, maybe at their yoga studio or just casually, at home with a book or something, and it didn't go well. In fact, it went terribly, or maybe nothing happened. But that happens a lot. And it's typically because they're just not ready to detoxify. Why are they not ready? Maybe they have gut issues first. Maybe they have constipation. And if we're trying to mobilize toxins in the body, and a person is constipated, those toxins are just going to recirculate. Or maybe they have interstitial cystitis or something that makes them not a good candidate for detoxification, because detox, like I said before, causes inflammation. That just comes with the territory. So if you're already under a lot of inflammation, we want to put those fires out, prepare you for detox. And so that's what my ebook is about.
It's this is so important, you guys. Like all of this is so important. I think so many people just think that this like more is better and just like push the toxins out as fast as you can is the way to go. And I could not agree like more with your philosophy around like we got to get prepared for this. This is inflammatory. It's going to be harmful. We got to do this, this inflammation, this anti-inflammation pre-tox type of work. So I hope everybody takes a huge advantage of this offering. It's super, super generous and special, and we really appreciate it.
Thank you so much, Diane.
My pleasure. My pleasure. Well, it's certainly been a complete honor to have you with us, and great knowledge. I think this is a really, really important topic and really important to talk about, and a missing link, so thank you for just educating us on this huge missing link of chronic disease and of healthcare.
Thank you. It's been an honor to be here.